Welcome to U.S. Health Policy. I'm Dr. Donna Gourlay. Today we'll review the process in the United States for developing policy related to public health. Policy plays an important role in our everyday lives. However, most people don't know how policy happens, what it is, or even how they can make an impact on policy other than the ballot box when they vote. One of the main goals of PCOR is for you to understand the policy process, and more importantly, where you can have an influence on the policy process, and ultimately the outcome for the public. So what exactly is policy? Simply stated, policy is a plan of action agreed upon by a group of people, such as legislators, an organization's administration, or even parents. However, this group of people have the power not only to implement, but to enforce this policy. Here in the United States, the Wild West is romanticized through books and movies about a new frontier with cowboys fighting off wild Indians, Native Americans, animals, and damsels in distress, which were probably from the cowboys. In reality, living in the Wild West was an extremely harsh experience with limited to no resources, such as law enforcement and healthcare, extreme weather, such as drought, snow, wildfires, and floods, and no laws to protect people living here. People in the West often took the law into their own hands and sought justice for themselves, their property, and their families. This picture depicts a group of men escaping from one of two situations. They were perpetrators and did something to provoke the group chasing them, or the opposite occurred. They were being chased by the perpetrators. Either way, this doesn't end well for anyone. This is anarchy, which is the result of a lack of policy. Eventually, laws, or policies, were established in the rest of the U.S. and were enacted and enforced in these new territories, which would later become states. Switching now to why policies are needed, there are several reasons that I've listed. 1, basic needs aren't being met. An example would be a certain group of community members who don't have access to health care, which is considered a basic need rather than a luxury. 2, people aren't being treated fairly, such as civil liberties that state that all people shall have access to life, liberty, and the pursuit of happiness. If current policies aren't effective or being enforced, the third example is this may prompt a need to change an existing policy to allow a policy to be implemented. And then sometimes proposing changes to policy could create more harm than good. An example would be a requirement to allow disclosure of a patient's health status to their employer, which was a proposed policy a number of years ago and happily was not passed. In light of new information, such as research on workplace exposure to a certain chemical, perhaps causing cancer, a policy would be required to reduce or eliminate that threat to occupational health. In the illustration, policy intersects when scientific evidence, political will, and social infrastructure collide to benefit a group of people. We've just talked about reasons why policy is needed. Now let's briefly discuss the roles that policy play. First, policy are the rules that everyone must follow. Policy sets guidelines for our actions. It distinguishes roles for each group and their corresponding responsibilities. Policy reflects the values and beliefs of the organization setting the policy. And finally, policy states an intervention for something to occur. A brief example of this is the policy for hazardous waste in California. It outlines rules. It describes enforcement actions, including fines and penalties for non-compliance. It identifies who is responsible for implementing this policy or law. It identifies why the policy was initiated in order to protect public health and the environmental quality. Later, I'll give you a more detailed example. Policy is not found exclusively in law, however. Tools that can and have been used to implement a policy include the following: information, which can include data and even education; legislation, which can include regulations; standards, which are not enforceable by a legal entity unless they are adopted as code by that entity. An example would be the Life Safety Code, which are standards that are developed by the National Fire Protection Association for building fire safety. Programs, which are usually described and promulgated by the policy, and taxes and other funding mechanisms, such as fines. Within the United States, as well as other countries, the policy process is driven by a problem. For example, in the 1980s, used needles and other medical waste were washing up on beaches in New York and New Jersey, posing a health threat to beachgoers because some of these had been tested positive for HIV. This was definitely a problem, right? What happened next was that the federal government, specifically the United States Environmental Protection Agency, or EPA, drafted an interim policy on medical waste management. It was implemented in 4 states and Puerto Rico for 2 years, then evaluated to determine its effectiveness. This is a good example of how the policy process works. Policy is made at the federal, state, and local, county, and city levels and follows a similar process. This graphic depicts a similar policy process, except that it applies the previous principles to a political process. Now, before we go on, I need to define politics. As our textbook says, politics is about who gets what, when, and how. It's about the use of power to get and use resources for the benefit of an individual or group interests. So in this policy process, we want to start with discussion and debate, which occur over an issue or problem. Next is the political action that is proposed, which is then incorporated into draft legislation. Once these are passed by a legislative body, a law or policy is established. Laws are usually very general, but hold power in the penalties assigned to them. Back in the 1980s and 1990s, environmental policy had strict penalties, some up to $25,000 per day for violating hazardous waste disposal policy. These policies identified regulatory agencies who were empowered to develop corresponding regulations, which were very specific and described how to implement the policy. Using hazardous waste policy as an example, California's Health and Safety Code, where state environmental law is found, identified Cal EPA as the regulatory authority to develop regulations and enforce them. That brings us to compliance, which is a form of evaluation of the policy through inspections, citations, and penalties issued, but it's based on the original policy. Keep in mind that regulations hold limited power, but the policy carries the penalties, such as fines and/or incarceration for non-compliance. Let me give you an example of how policy is drafted in our state. In 2006, the California Assembly passed Assembly Bill 32, AB 32, the California Global Warming Solutions Act, which is represented by the purple box labeled legislation. However, to get to this point, a lot of work went into developing this policy. First, an issue had to be identified, and it had to be serious enough to warrant either a change to an existing policy or a completely new policy. In this case, a variety of conferences took place, and I personally attended a few of them, with presentations from scientific experts that showed the relationship between vehicle emissions, greenhouse gases, and climate change. With this evidence, and public health is part of this group of experts, policy was starting to be drafted in the form of unofficial documents, such as green and white papers. However, policy can't be drafted in a vacuum. It needs input from the public, usually from stakeholder groups. As you can see from this graphic, public comment intersects this policy process several times. Not only is a draft released, but public comment sessions are held so that the public has an opportunity to submit written and verbal comments, either in support of or in opposition to the draft policy. Public comments were assimilated and changes were made to the document that was sent back out for public comment after significant revision. For each comment, the regulatory agency proposing the policy, the California Air Resources Board, or CARB in this example, must capture and address each comment, identifying if the comment was substantial or not. Then the agency submitted its final policy draft for approval. Both at the state and federal levels, this policy needs a sponsor in the form of an elected official to take this forward and shepherd it through the approval process and lobby for its support. For AB 32, this was Assemblyman Fabian Nunez, and consequently his name is printed on the policy. After the policy was approved, it was signed into law by the governor or the president for federal policies. Next regulations must be drafted by CARB on how to enforce the policy. But remember, CARB is the regulatory agency designated to implement and enforce AB 32, so they will be the ones in charge of developing regulations. Once the regulations are approved, the policy must be introduced to those who will be impacted by it, such as businesses, citizens, and government. And they must be educated about what they need to do to comply with this new law. As the policy is implemented, reporting must be routinely occurring to a governmental oversight agency on the effectiveness of the policy. Here's a list of the influencers of public policy in the United States and other democratic countries. There's a lot of things to consider when proposing and implementing policy. Take a look at this graphic and answer this question. Which of these influencers happen behind the scenes and which happen in the public's view? How much transparency is needed for effective policy development and implementation? Often it feels like policy is made without our knowledge, let alone our input. How can we as public health professionals influence policy development? In the U.S., we have an initiative called Health in All Policies, or HIAP. This initiative started in 2006 in Finland and has spread across the globe as a policy strategy. It has 3 fundamentals. Number 1, integrate health across all sectors. Number 2, collaborate to achieve goals. And 3, benefit all people, not just certain groups. Here's an example of how California has implemented Health in All Policies. The Department of Public Health and the Governor's Office of Planning and Research partnered to expand the availability of affordable locally grown produce through the use of land use strategies. These 2 agencies collaborated for the good of Californians to tackle the problem of obesity by using policy or land use codes to increase access to healthy foods. This graphic models how a variety of factors are used to shape policy, including certain health issues, determinants, and inequalities, how policy and those who have a stake in a health issue play a supporting role. Data, listed at the bottom, plays a significant role in evaluating policy options. And the best options are then selected and trialed with case studies brought forward as examples. Now, my previous example of the Medical Waste Tracking Act was trialed for 2 years, with data being used to evaluate the policy that was implemented before taking this as a national policy. Health in All Policies is designed to touch all areas of influence that intersect with people, including disparities, food, housing, jobs, recreation, and safety. This graphic from the Bay Area Regional Health Quality. This graphic from the Bay Area Regional Health Inequities Initiative depicts how health and associated inequities intersect all areas of our society, from upstream social, institutional, and living conditions on the left, to downstream behaviors, diseases, and injuries, and ultimately death depicted on the right. Notice how policy, circled in red at the bottom, weaves through all these areas, while advocacy is applied to institutions to leverage change through research, community partnerships, and policy development. I've described the policy process and influencers of policy. Let's take a look at two preventive services task forces in the United States and how they work to influence health policy. The first is the Community Preventive Services Task Force, located in the upper right quadrant of this graphic. And it reviews preventive services options that impact large groups of people and even communities. The members of CPSTF represent a wide variety of stakeholders in public health and reviews scientific evidence on interventions to improve the longevity and quality of life for the public. The U.S. Preventive Services Task Force, located in the lower left quadrant, is made up of healthcare professionals and ranks evidence-based clinical preventive services for patients in a primary care and healthcare institutional setting. Based on this chart, you can see that the CPSTF has far-reaching influence compared to the USPSTF, with some overlap. Remember, while these may on the surface appear to review the same things, CPSTF has influence over public policy and public health. But both are needed to increase longevity for the U.S. population. As public health professionals, we must understand the policy process and how we can influence it for the benefit of all. Thanks for watching.